an educational talk about which intraocular lens, or IOL, is right for you. When it comes to cataract surgery, you're going to have to make a decision. So before we launch into the discussion, it's important that whenever an expert is giving a talk on a matter, that they disclose if they have any financial relationships with some of the companies or products that might be mentioned in the talk. You may or may not know that many doctors choose to serve as paid consultants or medical advisors for drug or medical device companies. And so these doctors are getting paid by the companies that make the product that the doctors are then recommending to their patients. And that represents a conflict of interest. Now, it's not necessarily a bad thing that some doctors do this, because that's how innovation happens in the medical community, but that needs to be disclosed to patients. I do not serve as a consultant for any industry companies. I'm never paid for any speaking engagements, so this is purely for educational purposes. All the views in this talk are mine, and they come from my own experience and training and continuing education. And all the slides in this presentation were made by me. And California law has made it simple for patients to learn about their doctor's possible conflicts of interest by visiting the site openpaymentsdata.cms.gov. So if you ever want to search your doctor and see if they're getting paid by medical device companies, it's easy to find out that information. So a bit about me. I've been performing cataract surgery now for just about 20 years. And I'm what's considered to be a high volume surgeon. I do between 100 and 150 surgeries per month. And to date, I've probably done around 15,000 total cases. And I've seen a lot in my career, a lot of advances in technology. And I do have an interest in supporting cataract surgeons in developing countries. So when it comes to cataract surgery, the menu used to look like the photo to the left. Everyone here should be familiar with the in and out menu. And I love that menu. It's simple. You can glance at it. There's only a few options, and the prices are straightforward. Fast forward to today, and now when it comes to cataract surgery, the menu is more like the menu at the Cheesecake Factory. It's a spiral-bound notebook with a lot of fancy options, and sometimes it's not totally straightforward what you're ordering. That's the reason why this talk is important, to explain what's on the menu. But before we get into all of that, it's important to know the elephant in the room. And that is, a lot of what I'm talking about today is not covered by insurance. So it represents an out-of-pocket expense to the patient. Insurance only covers what we call standard cataract surgery with a monofocal IOL, and we'll get into what that means. And all of the technologies beyond that come with a price tag, and there's no insurance plan that I'm aware of that will pay for some of these technologies, so then the patient needs to pay out of pocket for them. And this does represent a conflict of interest for the surgeon, because here I am talking to you about things that might help you, but I'll also get paid more if you decide to choose some of these options, which is why we have to be upfront about this. You have to make sure you understand what is covered and what's not covered, and what you can get for your money. Now, it seems that, especially in the last 2 or 3 years, I've had more and more patients coming to me for a second opinion. They've kind of gone through this process where they had a cataract evaluation by another surgeon or another facility, and the patient kind of got the sense that they were just sitting in a big sales pitch and trying to be sold something that maybe they weren't so interested in. And it kind of made them lose trust or confidence in their surgeon. That's not my style. I'm never pressuring patients. I just want them to know what the options are, and then you can make the decision about what's right for you. So let's talk about cataract surgery in general and the planning process for cataract surgery. You'll have a full exam with your doctor. We'll determine the general health of your eyes, how much astigmatism you have, and what types of technology might benefit you if you're interested. We take measurements of the eye, and then we develop a surgical plan. And during this process, you should never feel rushed. I don't like to have just one visit where we plan everything and the patient doesn't have any more opportunity for questions. So we always leave it open. If you need more time to consider your options, you should never feel like you're rushing into anything, especially with an elective procedure like cataract surgery. The surgery itself is pretty much a piece of cake. It's a 10-minute procedure. Numbing drops and an IV relaxing agent are used to keep you comfortable. We remove the cloudy cataract lens from your eye through a tiny incision and then put a new artificial lens in its place. And that artificial lens is what you have for the rest of your life. And that's why it's important that you understand your options, because whatever lens you have, that's what you're going to have for however long you're looking out of your eyes. The eye is sealed closed without stitches in most cases. So let's start walking through some of your options when it comes to cataract surgery. The first option is the option that the vast majority of my patients choose, and that's standard surgery with a monofocal IOL. Monofocal means one level of focus. Usually we set it for distance focus, and then if you want to see intermediate or close, you'll still need reading glasses or bifocals. Some patients choose to be nearsighted so they can see up close without glasses, but then they would need prescription glasses for far away. There's no additional charge for a monofocal lens, and we try to get the distance vision as good as possible. And if you don't have a lot of astigmatism, your distance vision might be spectacular, but the near vision will for sure need some help. So reading glasses are expected. Prescription glasses would be required if you have a significant amount of astigmatism or if you've had prior refractive surgery. That's LASIK or radial keratotomy or PRK. Oftentimes, prescription glasses are needed after cataract surgery if we don't get the exact power inside your eye that you need. So beyond the standard surgery, we start getting into some options that you can choose to add on. And now we're entering into the territory where it's not covered by insurance for the extra technology that we're using. So the first thing that we may discuss with you is the option of using what's called aura measurement during cataract surgery. This isn't changing the type of lens we put in your eye. You're still getting a monofocal lens in the eye. But what the aura measurement allows us to do is during the cataract surgery, after your cataract has been removed, we can take another set of measurements. And that kind of allows us to fine tune the lens power that we put in the eye. And so if you've had LASIK or PRK, or you have a little bit of astigmatism, we might not be totally certain about our preoperative measurements. And this intraoperative measurement allows us to select the lens power that can give you the distance vision as clear as possible. Or it also allows us to do something called monovision, where we set one eye for distance and one eye for near, or mini monovision, where we set one eye for distance and one eye for intermediate. These are options that we can discuss if you've done it before with contact lenses or a laser. If you've never experienced monovision before, it's not a good idea to do that with cataract surgery because you might not adapt to it. Again, if we're using the aura measurement, all we're doing is giving ourselves a better chance of selecting the right lens power, but we're still putting in a lens that doesn't have the ability to give range of vision. So it's not a completely customizable option, but it does give us a little bit of a better idea and a better outcome with your distance vision. I still tell patients that they're going to need glasses for some situations if we go this route, but we're more likely to get the mark. And again, this is not an upgrade of the lens. It's just another step of the surgery that you're paying a little extra for. This next option, we're talking about upgrading the type of lens that goes in your eye. For patients who have a large amount of astigmatism, and your surgeon can talk to you more about what astigmatism means in clinic, but this is an example of a scan of somebody's eye that shows they have this bow tie pattern of distortion on their cornea. That's what astigmatism is. And if your cornea isn't perfectly round like a soccer ball, that astigmatism will blur the vision. And if your astigmatism meets certain characteristics, it's possible to correct the astigmatism with a special kind of lens called a toric monofocal IOL. This toric part of the lens is an additional fee, but it can help correct the distance vision and get you away from requiring prescription glasses. Reading glasses would still be needed for near unless you get one eye for distance and one eye for near with monovision. But prescription glasses for far away vision is far less likely required if we use the toric lens. Well, what if you want to see far, middle, and close without glasses? This is possible. This picture at the top simulates what vision with a monofocal lens will look like. You can see the mountains in the distance quite clearly, but to see this sign, which is at an intermediate range, or your cell phone at a close range, that's going to be blurry and out of focus with the standard monofocal lens. But there are lenses called multifocal lenses that have built into them the ability to see far, middle, and near, all without having to worry about putting on glasses or even worry about what part of your lens to look through, because the entire lens can see distance, the entire lens can see middle, and the entire lens can see close, just like you may have been able to do when you were 20 years old. So the lenses that can do this, one brand is called the Panoptix lens, and one type is called the Odyssey lens. These lenses are an additional fee, but they can be a good fit for the right patient. What I'm going to say a few times in this talk, though, is there's no lens that can fix everything. So there are trade-offs with this technology. One thing that patients might complain about with this type of lens design is when they're driving at night, they may see halos or glares around lights, or another thing they might notice is limited contrast sensitivity. So there's a little bit of a sacrifice of the distance vision to get that near vision built in. But this type of lens gives you a very high chance of no longer needing glasses for any distance. So what if you do a lot of night driving? What are your options then? Well, this photo here kind of simulates the halos and glares you might experience with the Panoptic lens or the Odyssey lens. Not all patients experience it to this level, but this simulation kind of shows what patients might get bothered by. And I've had patients say that they really notice this in the first few months after surgery, but 6 months later, they don't notice it as much. But I also have had a handful of patients where these halos and glares really disturb them. And if you do a lot of night driving and you don't want any chance of these increased halos and glares, there is an intraocular lens option that doesn't have that risk. And that's called the Vivity lens. The Vivity lens lies in a class of lenses called an extended depth of focus lens. These lenses are focused for distance vision, but they can also see in the intermediate range. So your computer screen, your dashboard, your cell phone, if you're holding it far enough away from it, all of that can be in focus. But the tiny print at near with the Vivity lens, you probably won't be able to see it. You'll need reading glasses. But this lens has fewer incidents of the halos and glares, so driving at night can be more comfortable with the Vivity lens. And the Vivity lens is in the same price range as the Panoptix and Odyssey lens. So all these technologies are priced the same, but you have to pick and choose which option is best for you based on your lifestyle and your needs. Well, that used to be where my conversation with patients stopped, but now there's a brand new technology that we have to discuss. Every lens that we've talked about so far, the way they work is they come in one power. We take a bunch of measurements before and sometimes during the surgery if you use the aura. Those measurements tell me which power will best fit your eye, and that's the power I put in your eye, and that's the power you have for the rest of your life. But now there's a type of lens called a light adjustable lens. And the way this lens works is we do all that. It comes in a certain power, and we put that power in your eye. But then after your eye heals, we can actually adjust the power of the lens, and we can fine tune it so that it's a custom fit for what your eye needs. And you can actually test drive the lens and walk around for a week or two looking out of it. And if we need to adjust it further, we can make another adjustment, and then we can lock it into place. So now we can actually customize your vision after the surgery is over. And that is a huge leap in our technology. Now, the light adjustable lens still has some limits to what we can do with it. For example, we can set both eyes for distance vision, but your near vision will be not perfectly in focus. And then when we're doing the adjustments, we can dial in more near vision if you need it, but we just dial it into one of the lenses. And so then you are doing a type of monovision where your brain just uses one of your eyes to see near and the other eye to see distance, but they can still work together most of the time. And if you don't adjust well to that situation, we can adjust it back. So it doesn't give you 100% guarantee of not needing glasses, but it is the type of lens that allows us to test drive it and change it as needed. And once we're happy and you're happy, we lock it into place and no more adjustments are done in the future. So this lens doesn't have the same risk of halos or contrast loss. And it is a great option, especially if you've had prior LASIK or PRK. And also if you're the type of person who really likes to have a hand in making some tweaks and customization, this lens allows us to do that. Okay, and all of this was really a take-home message, is that no IOL can fix everything. I wish there was one. That's the holy grail of intraocular lenses. The light adjustable lens is getting us closer to that mark, but still, this is human-made technology, and there's not some one-size-fits-all. And even the most expensive technology may not completely eliminate your need for glasses. No matter what lens we put in your eye, the new lens may form a film down the line that we have to clean with a laser. That's not a big deal, but the laser the haze that forms in there can reduce the quality of your vision until we fix it with the laser. And then once we fix it, it usually never needs to be repeated. And again, in this process, your decision should not be rushed, and you should never feel any pressure. Costs should not be hidden. All these things should be explained to you up front, and all options, including the ones that are covered by insurance, should be presented to you. I have had patients come to me and they had an evaluation done elsewhere, and nobody even explained to them that they could choose a lens that was covered by insurance. They were just presented with the more expensive options, and that's unfortunate. This is your vision and it's your choice. So it's always okay to ask your surgeon why they are recommending certain technologies, how much they will cost you, and what your alternative options are. And it's always okay to ask your surgeon about their level of experience. It's always okay to seek a second opinion if you don't feel comfortable with a surgeon or facility, especially for a non-urgent elective procedure like cataract surgery. So I know I threw a lot of information at you in a rapid form here. This is the part where we're gonna open up the microphones and also the chat so you can ask me questions. And please don't hold back. The main reason for this format is for your opportunity to interact with me, and I can go back and clarify some of the things we went over.